devastating services in those city hospitals. The memo said the cuts had seriously eroded access to care.
The Harlem community lost some great hospitals: Flower Hospital, Fifth Avenue Hospital, Arthur Logan, Knickerbocker Hospital, Francis Delafield Hospital, Mother Cabrini Hospital, and finally the tragic closing of Sydenham Hospital in 1984.
At a board meeting in the old Hospital for Joint Diseases, Randy Guggenheimer took a stand against what he perceived to be a threat for the health care in Harlem. And at that time, Randy solicited the help of Eugene McCabe, who at that time was also a board member in the old hospital. And together, they decided that they were not going to tolerate what they felt were going to be some injustices that were going to take place for this community.
You can't get around it. This hospital was gone.
There were times when we had no supplies. There were times when the equipment we needed didn't work.
The hospital was gone. It had no money. There was no expectation of money.
We still managed to give our patients the best care that we could.
The people who worked at North General Hospital, who have been working here at North General Hospital, some of whom have been here from the time the hospital was founded, were people who went sometime weeks without a paycheck.
Staff would work long hours and extra hours and not ask for overtime because they knew we couldn't afford to pay it in the early days.
Gene McCabe never stopped, never gave up. He would beg, borrow, steal, cajole, influence whichever way he could to keep this institution going because he believed it was vital to the progress of this community. And it was. He knew how to get things done, knew how to stay on people's cases. He would call and call till somebody answered him. He would go to see people at the drop of a hat. He would reach out to whoever he knew somebody to get the person to return his call.
The future belongs to those who believe in the beauty of their dreams. And we just believed in the dream that Gene and Randy had.
It looked a lot more like a science fiction movie set than a major New York hospital, but with the help of a block-long series of plastic tunnels, the staff and patients of North General Hospital in Harlem moved into a new building today.
It's a good day for New York State, it's a great day for New York City, and it's a super great day for Harlem.
We're all sweating inside, but it's a lot of excitement, and it's definitely a move for the better.
With the facilities that we have and the expansion of our staff, that we can really work as a first-class hospital, serving a community that we feel needs us very badly.
Talk about Randolph Guggenheimer, who stayed with this hospital, and Gene McCabe, the most significant person in the entire endeavor, who stayed and stuck and took a beating.
This hospital has survived, again, the great efforts of Gene McCabe and their present president and CEO, Dr. Samuel Daniel, who does a remarkable job.
I had been searching for ways to give back to the Harlem community.
Park Avenue and having a private practice was never in my scope of interest. As I embarked on my medical career, my intention was always to work in the community in which I was raised and give back to the community.
We have an incredible group of people that care about the patients and care about the community.
I feel very proud to be a physician at North General Hospital. People love this hospital. It's been their home. It's been their family. It's been a part of their lives from the very beginning. And the culture of the hospital does reflect that.
I'll stay here as long as I possibly can, and hopefully that's till the day I retire.
I do love to be here. I really enjoy coming to work every day. It's very challenging. I'm very excited by the changes we've been able to make and the vision that I see for where we're going. I do think that we are going to be able to help North General Hospital meet its goals of serving this community.
They have something major like cancer. It was scary, but they made me feel all right. They had some great doctors, great nurses, Mrs. Joseph and Mrs. Shaw. They became my angels once a month, and they were so good.
People act like they like working here. They make patients feel comfortable and wanted, and that goes such a long way in helping people who are sick to feel better about themselves.
At the end of the day, the most important thing they look at first is what kind of services are you providing to this community? Are these services that are going to meet the needs of the community and provide quality health care?
Our medical residents, when they take their board exams, pass at a 100% rate. And we have done this now 3 consecutive years in a row.
Despite the struggles, despite all the issues that we've had to address, at the end of the day, we've got a first-class medical operation here that provides care to this community.